Hi, I'm Michelle Dorn with Elite Healthcare, and I'm talking today with Lori Armstrong, who is the CEO and Clinical Chief Officer of Inspire Nurse Leaders. Lori, can you tell us more about you and your important work in leadership?
Yes, I'd be happy to, and thank you, Michelle, for having me. So glad to speak with you again. So I have been a nurse for a long time. I don't like to admit how many decades it's been, but perhaps 2 or 3 all of a sudden snuck up on me. And you know, at my heart, I'm still a nurse, always will be a nurse. And I went the traditional route in leadership, manager, director, and had the honor of my career to be a chief nurse. And all through those years, Michelle, I've just grown a passion, insatiable passion for the link between nursing leadership and patient and organizational outcomes. And I made the big decision, had a little bit of a calling, and made the big decision to start Inspire Nurse Leaders so that I could spend 100% of my time supporting, growing, helping nurse leaders be their best for themselves, for their teams, and for the patients we serve.
That's fantastic. And I know you do a lot of work around the country with all different types of organizations.
Yes.
So today we're going to be talking about engagement. So what is nurse engagement, Lori, and what does that look like in the work setting?
You know, I love the topic of engagement, and any nurse leader will know we talk about employee engagement all the time. As far back as I can remember, Michelle, employee engagement, we have our surveys. Some organizations do it every 2 weeks now. Maybe your organization out there does once a year. So engagement, and it seems like it's a generic topic. But when I'm talking to nurses and nurse leaders, I try to explain nurse engagement like this. I want everyone to think about nurse engagement as a relationship, because engagement means trying to measure the engagement of the nurse to the work that they do. So being a nurse, administering care. Engagement, so that relationship with being a nurse, the relationship between the nurse and the organization they're employed by, and then even a level of engagement between the nurse and the entire nursing profession. And I think that when you think about engagement in those 3 buckets, it kind of breathes life into the word. But when you also throw the word relationship in there, it takes on whole new meaning for the leader.
Yeah, that's really important. It's about the relationship.
Yes.
So why is engagement so important for nurse leaders, especially in today's environment?
Wow. You know, again, it's not just about that once a year or once a month survey, and you have to have an action plan, the dreaded action plan, putting it in the computer. When I was a chief nurse, Michelle, oh my God, HR, I used to get love notes. Lori, you're late on your action plan. They didn't say it like that. It wasn't as nice. But anyway, you know, it's so important now coming out of COVID-19, coming out of the pandemic. And that's only one reason. The second reason is because of our shifting demographics in nursing. So as if COVID wasn't important enough, you know, nurses, nurse leaders, the entire profession, we're just not the same as we were a year ago, right? So engagement is important. Are we still committed? Do we still have that close relationship with what we do, with our employer, with being a nurse in general? Is it still there? It's important for us to pay attention to that as nurse leaders. And then secondly, things are changing. Our workforce is changing. By the year 2030, millennials will be the largest segment of our nursing workforce, leaders and frontline nurses. So we have to figure out what engages that generation. It's different than my generation. Even though I just want to be clear, I'm pretty close to the border. I just want to be close with those different definitions. I found a slide that actually said I wasn't a baby boomer, so I was very happy about that. Anyway, we have to, in terms of engagement, the current state is absolutely critical. So we as leaders can nurture and develop that engagement relationship with our current workforce. It's critical, or we're going to lose them.
So That's such an important point, especially with all of the compassion fatigue and
Yes,
burnout, moral distress that nurses have experienced, the whole healthcare team has
right,
experienced, and who knows what the future will hold. So do you have thoughts on your vision for engagement as
right.
workforces change, as work
Mhm.
settings evolve?
I think that, you know, I'll start foundationally. I always like to teach this about leadership. You know, leaders influence other people. It's not a title, it's not about a title, it's about your actions and how you influence others. And the only way that you can positively influence others is if you know what's important to them.
Mm-hmm.
And that doesn't matter if you're a baby boomer, a millennial, and the upcoming Gen Z. It doesn't matter. It's still the leader is responsible for getting to know what's important to their workforce. So leadership hasn't changed. The context in which we deliver it has changed. So my recommendation for the future is that get to know your people. We
Mm.
as nurse leaders must get to know what's important for millennials. And honestly, Michelle, I really don't think we have all the answers yet. No one does. But what the emerging data is telling us is that this generation of frontline nurses and newer leaders have a profound commitment to connection and a profound commitment to giving back.
Mm.
So if you think about some staff who come to work to do their job and go home, first of all, there's nothing wrong with that. Everyone has a different life circumstance that they come, they do their good work with good intention, and they go home. However, the overwhelming majority of this current generation wants that deeper connection. So my recommendation to nurse leaders, number one, make it personal with your team. Make it
Mm.
personal, get to know them. And that's the hardest recommendation to give a nurse leader. My God, they have so much they're responsible for. How do you do that? Well, there's ways to do that. And I think that there are some recommended concepts that I talk about a lot that some people might say who's watching this or who's listening to this might say, that's not new, Lori. I get that. They're not new, but they need to be brushed off, refined, and reinvented for right now because they're actually perfect frameworks for being successful with the millennial workforce. And there's two, I would say, Michelle. So first and foremost, shared leadership or shared governance.
Mm.
The terms are used interchangeably. More commonly, shared governance, and it's a perfect way for nurse leaders to get to know what's important to their team. Because if you have the right structure in place and nurses feel comfortable and empowered to bring their ideas and their challenges forward and that they're going to be heard and acted upon, those ideas and challenges, that changes the dialogue. They feel
Mm.
that deep connection to purpose. The night intensive care unit nurse who happened to be the chair of her shared governance council at this big academic medical center on the West Coast. And she said to me, Lori, I knew last week when I took care of this ICU patient, he was intubated, but his wife was really frustrated about how hard it was to park and to get up to the ICU. I mean, she was sobbing. She goes, I can't even handle the sickness of my husband. And then you all really seem to be making it hard for me to get here. And what she said, her name was Diana. She was so inspiring. She said, I knew that the next week was our shared governance committee. And when I brought that forward, that the CNO and my nurse manager would hear me and act upon it.
Mm.
And I use the word hear a lot. It's a combination of hearing and listening. Like just hearing something isn't enough, but truly listening and getting to know, getting everyone involved in that conversation and making that's what it's all about. So if you have shared governance, I would challenge every nurse who's active in it to do a gut check. every nurse leader to do a gut check. Is it working? Are we measuring the output and the satisfaction of our shared governance? And if we haven't, let's do a reevaluation of it. Let's reevaluate. And then the second thing I always urge leaders and my clients and my colleagues to focus on, same thing, not a new concept, but the clinical or advancement ladder, or your clinical ladder, clinical advancement program, whatever your organization calls it. That has been in place for decades, as long as I've been a nurse. However, what does that look like? And is it relevant for right now? You know, back in the day, we developed these very rigid and very structured advancement programs that, you know, we had ideas, evidence-based or not, about how long you needed to do this and how many community hours and how many publications. Is that still relevant to the millennial workforce that is so truly purpose-driven? Maybe it looks a little different. Maybe it's more about exemplars and how they impacted that family from the intensive care unit. I don't know the answer, but I know, like I know my name, that if we engaged that front line, that they would help inform us of what's important to them, how to engage them, because Michelle, the shifting demographics, whatever nurses we have, we need to keep them at the bedside.
Right.
So.
Thank you. I can see why your company is called Inspire, Nurse Leaders, Lori. Those are inspiring words. Thank you so much for sharing your expertise with us.
My pleasure.